And now a moment from Your History and Health Comes First with Dr. Richard Brown.
Hello, this is Dr. Richard Brown again coming to you for the podcast today. Your History and Health Comes First. Thanks for joining us again. It is March 30th, so it's almost at the end of this month. Spring has sprung and the days are getting longer, the birds are chirping, the bees are buzzing, and it's a great time to be alive in America. So today, though, I want to talk about the history of slavery in America and how it has impacted U.S. medicine and how continuously it has negatively impacted the health of African Americans in this country today. My source of this information largely comes from an article that was written by an individual by the name of Villarosa, who actually took information from the 1619 Project book written by Nicole Hannah-Jones, who is a journalist in New York. So I'm going to begin by sort of reading a lot to you, specifically starting off about the account of one man's experience from when he was in slavery and experiments that was conducted on him and the problems that took place back then and the issues that took place back then, the lies and all that took place back then, which in some cases have been perpetuated, until recent history. So let me start. So the excruciatingly painful medical experiments went on until his body was disfigured by a network of scars. So John Brown, an enslaved man on a Baldwin County, Georgia plantation in the 1820s and 1830s, he was lent out to another physician who was a plantation owner. And this physician, Dr. Thomas Hamilton was his name. He was obsessed with proving that the physiology was different between Black and white people. So John Brown could be my cousin from another plantation, okay? But this Dr. Hamilton used Brown to try and determine how deep the Black skin went. So John Brown, who could be my cousin, got experimented on by Dr. Hamilton. So he used Brown to try and determine how deep Black skin went. So believing it was thicker than white skin, okay? So Brown, who eventually escaped from England, recorded his experience in an autobiography, which was published in 1855 under the name of The Slave Life in Georgia. So in Brown's words, Hamilton applied blisters to my hands, legs, and feet, which bear the scars to this day. He continued until he drew up the dark skin from between the upper and the under one. He used to blister me at intervals of about 2 weeks. This went on for about 9 months. Brown wrote, until the doctor's experiments had reduced me to being useless in the field, he continued with this work. So Dr. Hamilton was a courtly Southern gentleman, a respected physician, and a trustee of the Medical Academy of Georgia. And so, like many other doctors of the era in the South, he was also a wealthy plantation owner who tried to use his science to prove that there was differences between, Black people and white people. And he insisted that the Black bodies were composed and functioned differently than white bodies. So people during this time, they believed that Black people had large sex organs and small skulls, which translated to promiscuity and a lack of intelligence. And they had a higher tolerance for heat, as well as immunity to some illnesses and susceptibility to others. So these were lies, they call them fallacies. So these fallacies presented as facts and legitimized in the medical journals. They bolstered society's view and that enslaved people were fit for no more than just outside forcing them into labor. And it provided racist support for the ideology and discrimination of people, and they developed policies for this reason. So over the centuries, the two most persistent physiological myths that Black people were impervious to pain and had weak lungs that could be strengthened through hard work. It wormed their way into the scientific consensus, and they remain rooted in modern day medical education practice. There's another example. In 1787 manual entitled A Treatise on Tropical Disease, onto the climate of West Indies, there was a British doctor. His name was Benjamin Moseley. So he claimed that Black people could bear surgical operations much more than white people, noting that what would be the cause of insupportable pain to a white man, a Negro was almost, he would almost disregard it, which is insane. And so to drive the point home even further, he added, I have amputated the legs of many Negroes who have held the upper part of the limb themselves. Can you imagine that? He's cutting the limb off of another human being and some kind of way asked them to hold the limb while he's completing his surgery. And that's an example of how this Negro, the Negroes were different from white people, and that they could tolerate more pain than white folk. It doesn't sound like that should be true if that really happened, but irrespective of the truth, it's an absolutely cruel thing that took place if it did. So these misconceptions about pain tolerance seized upon by the pro-slavery advocates also allowed another physician by the name of Marion Sims. He long celebrated as the father of modern gynecology. And so he talked about this pain tolerance. And he maintained that he used to use Black women as subjects in experiments that would be unconscionable today, unconscionable. And there was no anesthesia or anesthesiologists back during these days. So he did experiments on women in Montgomery, Alabama between 1845 and 1849. In his autobiography, The Story of My Life, Sims described the agony the women suffered as he cut their genitals again and again in an attempt to perfect the surgical technique to repair childbirth. This complication that took place through childbirth was called vesico-vaginal fistula. So then there was the Thomas Jefferson, who was around at the time, you've heard of him before. In his notes on the state of Virginia that was published around this time, as Moseley was making his statements, and he listed what he proposed were the real distinctions which nature has made, including the lack of lung capacity. So he maintained that there was a lack of lung capacity in Black folk. And in the years that followed, physicians and scientists embraced Jefferson's unproven theories. None were more aggressively than Samuel Cartwright. Sam Cartwright was another physician and a professor of disease of the Negro. And he was at the University of Louisiana. Now it's called Tulane University. So he widely circulated a paper. It was called a Report on the Diseases and Physical Peculiarities of the Negro Race. This was published in May of 1851. And it was an issue of the New Orleans Medical and Surgical Journal. And it was cataloged supposedly by physician differences between white and Blacks, including the claim that Black people had lower lung capacity. So again, Cartwright conveniently saw forced labor as a way to vitalize the blood and correct the problem. Okay, so in order to correct the problem that was perceived as having lower lung capacity, that the thing you should do would be to work the person hard, work the person vigorously, and that would correct the problem. most outrageous thing that Cartwright maintained was that the enslaved people were prone to a disease of the mind. And I know he made this up. We know he made this up. He had to make this up. They were prone to a disease of the mind. It was called drapetomania, 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 which caused them to run away from their enslavers. The disease caused them to run away from their enslavers. This was a disease peculiar only to the Negro people. Can you imagine that? And he went on to say, willfully ignoring the inhumane conditions that drove desperate men and women to attempt escape, he insisted without irony that enslaved people contracted this ailment when their enslavers treated them as equal. And he prescribed whipping the devil out of them as a preventive measure. How insane can you be? He maintains that the disease came upon these Black people when white people treated them as equal. Then they would get this disease called drapetomania, and it would cause them to run away. And people believe that. It's amazing. It's amazing that they believed that back then. But then when you look at the things that people believe today, it's still amazing. So there's actually papers that was written by Cartwright back in 1851, talking about his and Hamilton's scientific experiments. And they really were sadistic. And it was only recently, 150 years later, that there were protests in New York City where there were statues erected that measured statues of Cartwright and others that did these experiments on Black folk. And they protested against it, and they actually removed those statues finally. So I guess you could say perhaps progress is being made. But to validate his theory about lung inferiority in African Americans, he became one of the first doctors in the United States to measure pulmonary functions with an instrument called a spirometer. Okay, using a device that he designed himself. So Cartwright calculated that the deficiency in the Negro may be safely estimated at 20%. All right. So today, most commercially available spirometers used around the world to diagnose and monitor respiratory illness have a race correction, a quote, race correction built into the software, which controls for the assumption that Blacks have less lung capacity than whites. So in 2014, in a book called Breathing Race into the Machine, the surprising career of spirometer from plantation to genetics, a guy named Lundy, who was at Brown University, professor of medicine science and African studies, notes that race correction is still taught to medical students and described in the textbooks as scientific fact and standard practice. Unbelievable. So recent data also show that present-day doctors fail to sufficiently treat the pain of Black adults and children for many medical issues. In 2013, there was a review of studies that examined the racial disparities in pain management published in the American Medical Association Journal of Ethics, and it found that Blacks and Hispanic people, from children with appendicitis to the elderly people in hospice care, that they received inadequate pain management compared to their white counterparts. In 2016, there was a survey of 222 white medical students and residents, and it was published in the Proceedings of the National Academy of Sciences. It showed that half of them endorsed at least one of the myths about physiology differences between Black people and white people, including that Black people that their nerve endings are less sensitive than that of white people. This is 2016, not too long ago. So when they were asked to imagine how much pain a white or black patient experienced in hypothetical situations, the medical students and the residents insisted that black people felt less pain. This made the providers less likely to recommend appropriate treatment. And a majority of these doctors to also, they still believe, in this lie that Thomas Hamilton, who tortured John Brown, my possible cousin, and it's 200 years ago this went on, and some people in 2016 still believe that black skin is thicker than white skin. And I will say from personal experience, I know that that's an issue out there and have been an issue out there, because 30 years ago, as I was in a particular capacity to running a healthcare facility, had the capacity to be involved in helping people to come from other places to get an experience in the healthcare facility. And so there was a young white nurse from a Western state who came to a Southern state and got involved in treating children, teenagers, and black folk. Well, this nurse had never touched a black person before, had any interaction before. And for the first time, she learned and was in awe and talked about it, in some personal discussions over and over, that she absolutely was astounded by the fact that black folk had soft skin. She did not know it was soft. She thought it was hard. She thought it was different from hers. In fact, she demonstrated that her skin is harder than the soft skin of some of the children that she was taking care of. And so, well, she was enlightened, of course. She certainly changed. It was a myth to her. I don't know how long she may have had it, but it was only through that experience, actual being around and touching black patients, that myth obviously went away. So this disconnect allows scientists, doctors, and other medical providers, and those in training who will fill these positions in the future, to ignore their own complicity in healthcare inequality and gloss over the internalized racism and both conscious and unconscious bias that drive them to go against their very oath, which is to do no harm. And finally, there was another author that wrote about this issue. And they begin by saying, the centuries-old belief in racial differences in physiology has continued to mask the brutal effects of discrimination and structural inequalities, instead placing blame on individuals and their communities for statistically poor health outcomes, rather than conceptualizing race as a risk factor that predicts disease or disability because of a fixed susceptibility conceived on shaky grounds and centuries ago. We would do better to understand race as a proxy for bias, disadvantage, and ill treatment. So the poor health outcomes of black people, the targets of discrimination over hundreds of years and numerous generations, may be a harbinger for the future health of an increasingly diverse and unequal America. So one more study was conducted just as early as 2016 by the National Academy of Science. And the title of this study was Racial Biases in Pain Assessment and Treatment Recommendations and False Beliefs About Biological Differences Between Blacks and Whites. This was done by authors by the name of Hoffman, Twawalter, Axt, and Oliver. So they begin by saying, specifically, this work reveals that a substantial number of white lay people and medical students and residents hold false beliefs about biological differences between blacks and whites and demonstrates that these beliefs predict racial bias in pain perception and treatment recommendation accuracy. Taken together, they state that this work provides evidence that false beliefs about biology and the differences between blacks and whites continue to shape the way that we perceive and treat Black people. They are associated with racial disparities in pain assessment and treatment recommendations. So one study in particular determined that these beliefs were very much true. And they strongly endorsed the false beliefs that biological differences reported that were reported made for lower pain ratings in blacks and whites. And so they demonstrated that they would treat people differently. In some cases, they might treat a black person with less medication, pain medication, and opiates than they would treat a white person, which means they might give a white person more opiates or more painkillers, which for the most part was a detriment to both of them. If you give too much painkillers to maybe the white patient, they become overly addicted, then you get the problems associated with opioid addiction. And if you give not enough pain medicine to the black person, then they suffer a whole heck of a lot more pain than they should, which means they might come back for more. And then you get to the emergency room and you view them as perhaps frequent flyers, as they call them, or drug seekers. And so it's just an example of how these old myths that have been around for hundreds of years can actually impact people on a daily basis when treating patients, today. So when a young man goes to a doctor complaining of severe pain in his back, he expects that the trust of the medical expert, who is the physician, will be to assess his pain and prescribe the appropriate treatment to reduce the suffering. The primary goal of the healthcare industry is to reduce pain and suffering, right? That's what they're supposed to do. And so this is supposed to be the standard of care that is expected. However, if you have these biases and these disbeliefs and these falsehoods, then you may absolutely treat the person differently. And this must be considered when not only as a patient you go to the doctor and is treated by persons that do not look like you, as well as the person treating the person that don't look like you. These things need to be taken into consideration, and both parties need to be aware of these things so that they don't mistreat a patient, or that a patient gets how he should be treated by this healthcare professional. So these disparities in pain treatment could reflect an overall prescription and medication for both white patients and black patients to be very different. An example of a study that was conducted as well from this particular author was that, let's see, for example, a study examining pain management among patients with metastatic or reoccurring cancer found that only 35% of the racial minority patients received the appropriate prescriptions. Only 35% got the right treatment in terms of the prescriptions, as estimated by the World Health Organization, which compared with the non-white patients who got 50% treatment took place with them, or 50% of them didn't get the right treatment. So broadly speaking, there are two potential ways by which racial disparities in pain management could arise. The first possibility is that physicians recognize the black patient's pain, but do not treat it, perhaps due to concerns about non-compliance or access to healthcare. The second possibility is that the physician do not recognize black patient's pain in the first place and thus cannot treat it. So hopefully we learn and do better going forward as we study history and as medical schools and residency programs actually acknowledge that there are differences and accept the biases that are out there, and that they start teaching it and start doing things differently so that we'll have a better healthcare system and a better America. So I'm going to read one more statement that was involved in this particular study, and it sort of points out how there's still comments and statements and things that need to be sorted out. So today, many lay people, scientists, and scholars continue to believe that the Black body is biologically and fundamentally different from the white body, and that race is a fixed marker of group membership rooted in biology. In fact, many people insist that Black people are better athletes, stronger, faster, and more agile as a result of natural selection and deliberate breeding practices that took place during slavery. Well, we don't know that this is absolutely true or not, but there's people that believe that, and continuous research is going on that may lend itself to some explanation. Finally, such beliefs like this are consequential because the research that has shown the biological conceptions and related beliefs are associated with greater acceptance of racial disparities. If you believe that a person is just genetically or biologically or physiologically prone to certain pain or lung capacity or physical capacity, then you may racially bias yourself against that, or you may despair against that. Or when the disparities show up, you may say, oh, well, that's because of who they are, and we shouldn't worry about it. We're not gonna look at that and think maybe the system is what's causing the problem. So anyway, with that, I'm going to close. Always remember that your history and health comes first. Thank you.
This has been Your History and Health Comes First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.